Guillain-Barré Syndrome, just think ground up berets, since clients get rapid ascending paralysis, starting in the legs from the ground and up. Now, this eventually reaches the respiratory system, which ends up killing the patient within a few hours or a few days. So think Guillain-Barré's as Guillain-Barré's. Go seek medical treatment immediately. Now, as far as the patho, it's an autoimmune disease where the body's own immune system is attacking its own nerves, usually triggered by an infection that's either bacterial or viral. And typically most patients won't even know they have GB until they get a really bad infection that triggers the immune system to fight, and that hyperimmune system ends up attacking its own nerves. Now, the key signs and symptoms to write down: ascending symmetrical muscle weakness, remember from the ground up, and then lower extremity weakness that progresses over hours or days, and then a big one to highlight here is absent deep tendon reflexes, which eventually leads to neuromuscular respiratory failure, which ultimately kills the patient. So please write this down because the NCLEX focuses on the most deadly signs for any disease. So for respiratory failure, the earliest signs is, write this down, inability to cough and the inability to lift head or eyebrows. Those two big ones came up multiple times on various question banks. And lastly, you have shallow respirations, dyspnea, and hypoxia. Now, respiratory always comes up first, so look for the keywords that deal with airway, like the ones listed above. So a common NCLEX question asks a priority finding with a client with Guillain-Barré's. So the inability to lift head or cough. Those big keywords there are very tricky. So don't get tricked on the NCLEX and know these key terms. Now for nursing interventions, we need to have an intubation setup at the bedside and mechanical ventilator ready. Kaplan had a question about priority for a patient with GB. We always prepare a mechanical ventilator for any client with worsening Guillain-Barré's. And for other treatments that weren't really mentioned by question banks, we can always use IVIG to help the body stop attacking itself and start attacking this IVIG substance. And also plasmapheresis, which is basically just plasma exchange. It filters the blood to remove antibodies that contribute to the destruction of neurons. But again, this wasn't highly tested, so just be sure to know the key terms that are mentioned above in terms of respiratory failure.